Hello again, class. Today we're going to talk about the history of health institutions and players. Public health programs funded in high-income countries and implemented in low-income countries are not a new phenomenon. The idea of intentionally influencing the health of people in low-income countries has been around in various forms for several hundred years. Understanding these historical efforts, including their exploitative roots and impacts, can offer new insight into global health approaches and strategies. Many colonial governments engaged in colonial medicine, which was designed primarily to protect colonizers from what were then called tropical diseases, rather than to protect indigenous persons from newly introduced diseases from the colonizers, or to otherwise safeguard the public health. We talked a bit near the beginning of the semester about the distinction between global health and international health. I want to return to that while we're taking this historical view, to convey that the era of international health started just after World War II, when a number of new international organizations, including the WHO, were founded. This time also marked the transition to independence for many formerly colonized nations. The general framework of international health was that rich countries would provide money and technical assistance to improve health in poor countries. Since many of these rich countries were themselves former colonizers, and many of the poor countries were former colonies, there were many conceptual ties to the era of tropical medicine as practiced by colonial governments. In the mid-2000s, international health transitioned into what we now call global health, which reflects an increasing awareness that health problems in one area of the world are tied to health problems in other places. Some critics consider global health to be just as neo-colonial and patronizing as international health, simply rebranded. Others obviously disagree. There are many major players in global health. There are multilateral organizations, multilateral financial organizations, bilateral organizations, private foundations, governments, and non-governmental organizations that are all part of global health. We're going to address each of those categories a bit. So, multilateral organizations are affiliated with the United Nations. The two UN organizations most explicitly involved in global health are the World Health Organization and UNICEF, both of which were created right after World War II. The WHO was based on the success of the Pan American Health Organization, a group of governments in the Americas, including the United States, that collaborate on health issues. The mandate of the WHO is to set norms and standards, to shape the global research agenda, to provide technical assistance and support to countries, and to monitor disease trends. It is governed by a body with one vote from every country in the world. The WHO's budget is relatively small, and it has historically come from dues paid by member countries. More recently, it has received funding from private foundations, like the Bill and Melinda Gates Foundation. The WHO has been shrinking in influence over the past several decades, but is still very much a major player in global health. The other multilateral organization most associated with global health is UNICEF. UNICEF was founded to help displaced and refugee children in Europe following World War II, and subsequently it had its focus shift to involvement in various child survival strategies and programs globally. Unlike the WHO, UNICEF does have a substantial budget due to extensive fundraising, and it is able to administer its budget independently of the WHO. It is most active in immunization programs, especially those targeting polio and measles, and is also involved in a number of other child survival programs around the world. The two major multilateral financial institutions are the World Bank and the International Monetary Fund, or IMF. They were created around the same time as the WHO and UNICEF, but have very different mandates than the WHO and UNICEF do. And they're referred to as the Bretton Woods organizations because they were founded following a conference at a fancy hotel in Bretton Woods, New Hampshire. The World Bank lends money to countries that it thinks will generate a return on its investment, and it's staffed by economists. Since the early 1990s, it has increasingly been lending to countries for health projects. In general, the World Bank believes that markets are the best way to deliver health care, which puts them at odds with those who argue for government-funded primary health care for all. In the last 20 years, the World Bank has become a major player in global health. The International Monetary Fund, or IMF, steps in when countries are in financial crisis. Frequently, this intervention takes the form of structural adjustment programs. Structural adjustment often includes the privatization of national industries and cutbacks in government payroll and employees. Often these steps can be devastating to government health systems, so many public health professionals are skeptical of the IMF. Bilateral organizations are aid agencies that are created by governments to assist other governments. The U.S.'s bilateral aid organization is the United States Agency for International Development, or USAID. Most major bilateral organizations give a substantial proportion of their funding to health programs. Bilateral organizations often have political goals. The United States government's biggest health aid recipients, for example, include Afghanistan, Pakistan, Jordan, Ethiopia, Haiti, Kenya, and Iraq. These are not necessarily the countries that need aid the most, but rather they are the ones where the U.S. has strategic, diplomatic, or military interests. Private foundations created with rich people's money have a long history of heavy involvement in global health. The Rockefeller Foundation, which was founded with oil money, implemented a number of disease control programs in many countries in the early 1990s. Currently, the Bill and Melinda Gates Foundation has an enormous influence in global health and sets many global health agendas. It has been mostly focused on technical innovation, like new vaccines or new technologies for mosquito control, as the way to solve a global health problem. Governments are perhaps the biggest player in health globally, as nearly every country in the world has some type of government health system. In the United States, for example, ours are Medicare, Medicaid, and the VA. And many other countries have a national health system for the entire population. There's also a dizzying array of non-governmental organizations, or NGOs, in health. Since the thing that they have in common is that they are not governments, it's nearly impossible to make generalizations about them. Sometimes they may be seen positively because they may be less bound by politics than other governments are, or than governments themselves are, I should say. At other times, they are seen negatively because they may draw resources away from government health systems. Some provide exceptional health services or organize effective advocacy, while others provide mediocre services yet produce glossy reports to impress donors, or in some cases provide few health services at all, functioning mainly to financially enrich the people who run them. It all really depends on the NGO.